Nakayisa Janet, an ophthalmic clinical officer working with Masaka Regional Referral Hospital. I'm a married lady with 3 children. I've served with the Ministry of Health for about 12 years now, because I started my services in 2008, serving as a clinical officer. I feel good in this service because I feel like when you like in cases of water, these people who come who are already blind, after surgery, when you operate them and they regain their sight, I feel great for that. I always see outpatients, those who come with these small eye conditions like conjunctivitis, infective conjunctivitis, trachomas, and and I also admit those ones which need admissions, like patients with traumas, eye trauma, that's penetrating injuries where they need repairs, those patients which need like cataract surgeries. We are missing an ophthalmologist to do these major cases, but the minor ones we always do them, like conjunctival growth. Those are patients who come with entropions. Those we can collect those conditions, but for major surgeries like cataract surgery, glaucoma surgeries, those ones most of the time we refer them to either Mulago National Regional Referral Hospital or Mbalala Ruhalo Eye Care Center or Mengo Eye Care Center also. Right now, the clinical officers are very few. People dealing with eye care, they are few. We need people just to get that interest of joining us so that we can help these people who are going blind because of ignorance. Because most of them, they go blind because they don't know what to do. But if we are many and we can move there down the ground, we can try to sensitize these people and tell them what to do. Okay, our role as clinical officers is to sensitize the community about eye care programs which move on, and to sensitize them about the eye conditions which are common in our communities, not to make mistakes. For example, I can give you an example, because some patients, they are there in the village, when they get an injury, maybe like on the eye, like they get what you call a corneal ulcer. For them, they normally use these herbs. Instead of seeking for medical attention, they go just straight to look for herbs, and that one will automatically complicate the situation. So, as a clinical officer, it will be good for us to go down there to sensitize them so that they know what to do and where to go for services. Clinical officer, we are supposed also to see these outpatients, treat some eye conditions which are not so serious. Those which needs ophthalmologist, we normally refer them to the ophthalmologist. These eye conditions, they are very common, depending where you are. Some areas, like here in Masaka, we are situated in Masaka, Greater Masaka. Normally, we don't get conditions like trachoma as compared to those living in the eastern. It's more common there than here in Masaka. But the most common conditions we get here, they are like those itchy eyes, like conjunctivitis, the itchy eyes, traumas on the eye, like someone may be, they are busy because we are dealing with the peasants, farmers. This area is full of farmers. Someone might be maybe cutting trying to make his plantation, prepare his plantation for then he can injure the eye. And when you get that injury, instead of using those herbs, we would want that person to know that there is an eye care center in Masaka where he can or she can get the right the right service. Just what I would emphasize, I urge the Ministry of Health at least to get at least one ophthalmologist to cover this hospital. Being a regional referral hospital, we need him seriously. No, we don't have one. That's why I'm urging the Ministry of Health at least to give us one ophthalmologist. The minor ones we do, but those which are beyond us, we normally refer them to Mengo Eye Department, Mulago National Regional Referral Hospital, Ombalala. I would just ask them to get interested in eyes, in ophthalmology. It is simple, and you feel great helping someone to see again. That one is, you feel like.